This is a Sandy Boy Productions podcast.
Welcome to the Urban Pharmacy Podcast, where we help women remove the overwhelm of living their most holistic life. This is the place to find evidence-based nutrition tactics, healthy lifestyle and wellness tips, abundance mindset, and easily implementable low-tox living strategies so you can rise up to your full potential and protect your family's health. I'm your host, Stacey Heine, certified holistic nutritionist and better living advocate. Now, let's get empowered with some simple swaps that make a big impact for optimal wellness. It's episode 8 of the Urban Pharmacy Podcast. Welcome. Today's guest you're gonna love. It is Dr. Ann Hussain, who is a naturopathic doctor and a period literacy advocate based out of Ontario, Canada. So ladies, this episode is for you. Dr. Ann helps menstruators optimize their periods, hormones, and fertility. Her personal experience with PCOS or polycystic ovarian syndrome drives her compassion to empower and educate menstruators to practice self-awareness, self-compassion, and self-advocacy. She believes that without health, we cannot show up for ourselves, our dreams and our goals, and the people who matter most in our lives. She personally is plant-based, loves eating chocolate, drinking tea, spending time in nature, and talking about menstrual health. In fact, Dr. Ann has created an online program called Periodicity, which runs for 6 weeks and is a roadmap to peaceful periods and cyclical living. Her program is live right now and goes live April 7th, 2021. So ladies, if you are looking for period advocacy and menstrual health, you should join this course. Now, in this episode, we talk all things from endometriosis to PCOS to anti-inflammatory diet, premenopause, thyroid issues, what to eat, or should we modify our activity during when Aunt Flo comes to visit? Oh my goodness, so many different things, hormone imbalances, and really just also about naturopathic doctors, because some people just don't know that naturopathic doctors are out there for women to work with in terms of their hormones and menstruation, etc. But please listen in on this episode. You are going to love it. I hope that you love it as much as I do. It is so good. Please leave a comment or a 5-star review if you like this episode, and we will see you on the next one. But until then, here is Dr. Ann Hussain. Dr. Ann Hussain, thank you so much for being on the Urban Pharmacy. We are so excited to have you here.
Thanks so much for having me. I'm looking forward to this chat.
All right. So let's talk women's wellness today. There's so much out there in the field of women's wellness, and we're probably just going to scratch the surface today. But I've fielded questions from my wellness group and also have some personal questions just in regards to women's wellness in things that I see happening, recurring, especially now that we are at childbearing age, or I am, and just women growing up and basically what they have had in terms of issues. So, all right, let's go into it. What are the first few things that you would suggest for people who are struggling with endometriosis and PCOS, like in regards to natural cures?
Okay, so endometriosis and PCOS, obviously the approaches are a little bit different because the the underlying issue is a little bit different. So in endometriosis, there's a lot of inflammation and immune dysfunction that is causing the pain associated with it, the reproductive dysfunction associated with it. And with endometriosis, the tissue that's kind of like our endometrial lining can be present not just in our reproductive organs or around our reproductive organs, right? It can actually travel quite far to around our gut. It's even been found around people's lungs. So endometriosis is so interesting, and managing endometriosis ultimately becomes about decreasing inflammation levels by boosting antioxidant levels, decreasing our exposure to inflammatory compounds. That could be environmental toxins, that could be pesticides, that could be saturated fat, that could be, processed foods, refined sugars, and so much more. Food sensitivities, if people have sensitivities to certain foods and they don't look the same for everybody. And then using herbs and stuff like that. There's some really beautiful herbs out there that can be really helpful for endometriosis, like ginger is one of them. Boswellia or Indian frankincense is one of them. Making sure vitamin D adequacy is there. And for vitamin D, always test, don't guess. I live in Canada. So in Canada, pretty much most of us are walking around vitamin D deficient, and the general guidelines to take 1,000 IUs are typically not enough for the average person to bring those levels up. They might keep you where you're at, but they're not going to bring you up if you're actually deficient. So those are some of the strategies for endometriosis. Endometriosis is hard, right? Like even the diagnosis is so hard because the gold standard is laparoscopy. And obviously that's an invasive procedure. There is a blood marker called CA-125 that you can help rule it in with. And you can test inflammatory markers on blood work, which is also really helpful and can sort of give us an idea of the general inflammatory burden on the body. So that's endometriosis. When we come to PCOS usually is not just a hormonal disorder. It's again, like the underlying issue is a metabolic disorder, right? So our metabolism is doing interesting things, and in most cases, it's driven by insulin resistance or this propensity to not be sensitive to our hormone insulin, which helps with blood sugar regulation. So that drives up inflammation again. Similar to like endometriosis, there is that inflammatory sort of pathway that's going on. It will disrupt our hormones, like our sex hormones. So from the brain as well, like our master hormone called gonadotropin releasing hormone that comes from the brain and gets us to release luteinizing hormone and follicle stimulating hormone. Like those are disrupted as a result of that. And then we may have higher testosterone. If someone doesn't have insulin resistance, they might have elevated DHEA, which comes from the adrenal gland. So really pinpointing where someone's PCOS is coming from and what's happening in their body and addressing it appropriately. But if we talk about the more common sort of PCOS, which is the insulin resistant kind, then we obviously want to manage blood sugar and, a high fiber diet that's low in saturated fat, that's high in fruits and vegetables is really, really key here. And same thing for endometriosis. Dietary wise, like they look very similar, right? Like endometriosis, we want to increase fiber, we want to increase fruits and vegetables, we want to decrease dietary saturated fat and inflammatory foods or processed foods, refined sugars and stuff like that, while also making sure there's protein adequacy, because in order to have a regular healthy cycle, which in PCOS you may not have, irregular cycles are super common, we need adequacy of all our macronutrients. So that's a little overview of what may be helpful for endo and PCOS.
So lots and lots of anti-inflammatory foods such as fruits and vegetables and phytonutrients that provide us with that. Okay, good. Mm-hmm. So speaking of that, an anti-inflammatory diet. Somebody was curious about where to start and how to eliminate things. Is it one at a time? Is that how you suggest it? If they are, maybe having dietary issues or just inflammation in general, like where would you start with that?
So it all depends on what else is happening in the body, right? Like ultimately when, for example, someone comes to see me, I'm doing a full assessment. We're talking about diet and sleep and stress and periods and hormones and everything else that's going on in their life. I don't do a lot of like big dietary overhauls because I just don't think they're sustainable. Although some people really like them because it's a good kickstart for them if they have a plan to follow for a week. They're like, I just want something that will get me out of my regular eating habit. While there's others are like, I just want to go one baby step at a time. So it really depends on who's sitting in front of me. Oftentimes I start by removing the most sort of offensive foods for them. So if they're saying like, every time I eat dairy, I feel terrible. So I'm like, okay, let's take out dairy let's take it out for a couple of weeks to begin with, right? Like it's always nice to do a trial and error, or removal and then reintroduction, because it really clarifies symptoms quite significantly, because you remove it for 2 weeks, you feel better, and then you reintroduce it and you feel worse. That's like, you've done both tests, removal and introduction. So dairy, I would say, is a big culprit, especially with my PCOS patients who get a lot of cystic acne because it increases testosterone production in the skin. And I know this because I've been there. I remember those days of the cystic acne because I personally have a history of PCOS, which is why I talk about it so much. And then the the other thing that can be helpful is to sort of start to pay attention of what foods aggravate you. So like, let's say you're feeling really crummy in a day. What did you eat that day? Do an inventory. And maybe those are, if you're seeing a consistent pattern over the span of a week, that, hey, I had, I don't know, I had eggs every day, or I had beans a certain kind of bean every day. And I feel like my symptoms were worse. That's a good point to start as well. I always going back to what I was saying earlier, I usually take out the most offensive food and put in the most impactful food to begin with. So for someone that might be fruit, I just wrote a post on this on Instagram. I have a lot of PCOS patients who are avoiding fruit because of the sugar content, which is just so not true or accurate or needed. We need fruits. Please eat your fruits. So adding in berries or adding in fiber or like other healthy fats, like those are usually the places where I'm starting, because oftentimes for us, even if we just add in good things without removing the not so great things, we still start to shift the needle on our health.
I love that. Oh, I love that. That's a good approach. So yeah, because I think, well, and there is a huge fruit fear out there. It is crazy. People are fearful of fruit for so many different reasons, whether it's insulin resistance or PCOS or whatever. And that is something that we definitely should be keeping in our diet. I agree wholeheartedly on that. Okay, so shifting to a little later in life, what is the difference between perimenopause and premenopause?
So they're used interchangeably, actually. Perimenopause is basically the time, like peri means around, pre means before, and menopause means, cessation of periods. So they're used interchangeably. I call it perimenopause because the symptoms of menopause or perimenopause can persist into menopause and after menopause. So that's what I'll say to that.
Okay,
It's a time, it's a time when things are changing. The end of your menstrual life is approaching. So there's a lot of hormonal shifts that can happen.
Got it. Okay. How would you suggest to naturally help a low thyroid or somebody who has hypothyroidism?
Okay, so someone who has hypothyroidism, one of the things that sometimes is missed is running antibodies in these people. And so antibodies are, your immune response. So what I mean is autoantibodies. So antibodies that you might be making against your own thyroid. Oftentimes, not oftentimes, well, some of the time they can be elevated in people. So that's the reason why your thyroid is under functioning a little bit, is because your body's mounting this response against your thyroid. So Hashimoto's thyroiditis is one of the most common thyroid autoimmune issues that's present. And again, like I know this because I have it. So that's really important to note, because the pathology or like the mechanism going on behind behind your skin or under your skin or inside your body is a little bit different in that case. So we need a little bit more immune modulation in that case. And there are some really nice studies on like vitamin D, inositol, selenomethionine really helping out with Hashimoto's thyroiditis. For people who have, non-immune hypothyroidism, It really depends on, again, like thyroid function is nothing in your body works in isolation. Everything works together. So we can't really support the thyroid without supporting the rest of your body. And usually, if we look at people who have thyroid issues, they come up, they might have a predisposition, they might have a family history, for example. And after a stressful period of time, whether that be like life circumstances, whether that be mental, emotional stress, whether that be like body stress in the sense that you're not sleeping enough or you had a chronic infection or something like that. Thyroid issues are very common after that, which can be transient because when the body's stressed, the thyroid does, start to try to work a little bit harder. So stress management really does play a role here as well. And then supporting with thyroid specific nutrients. So making sure you're getting adequate iodine in your diet and not too much, getting enough selenium in your diet and not too much, making sure your B12 and iron are at good levels because you need those in order for your thyroid to function properly. Your vitamin D levels, really important here as well. And then some of the protein precursors, like the amino acids that we need to convert our thyroid hormone or create our thyroid hormone. So making sure like all of those are present. And the other thing that impacts thyroid really significantly, which is quite popular, is really long periods of fasting. So most of fasting research, especially like long-term intermittent fasting and stuff like that, is done in men. So I always have this conversation with my menstruating populations because my menstruators, you guys are a little bit more sensitive to long-term fasting. Your body's, again, that going back to that master hormone in your system, it's always checking for nutrient availability. If it's not around, your cycles are really easily disrupted. So long-term fasting can also impact, like if it's short-term for a few days, not a big deal, right? Like, or if you're doing it occasionally, also not a big deal. But chronic, like really long fasts, like I've had people do like 20-hour fasts. It's a no-go in my practice for my thyroid patients.
Got it. Okay. Very interesting. Okay. So how much does modifying or changing a workout matter during Aunt Flo's visit?
It really depends on who you are, right? Like some people feel really great right from the get-go. Some people, like me, not so. I want to nap all day. So it really depends on who you are. I always say that modulate it to your needs, right? Like most people, because their hormones have dropped, right? Like the first couple of days, especially, hormones have dropped. You're losing blood. You may or may not have iron deficiency. I'm gonna just like throw out there, like I have a genetic form of anemia. Like I usually share all my problems when I talk to people so that they understand like where I'm coming from also. So I have a genetic form of anemia called thalassemia. So like blood loss for me is like really hard. Like my body already tries so hard to always keep oxygen levels really, adequate. And then when I'm losing blood, it tries even harder. So it's extra for me. It feels like extra. My body's spending so much extra effort. So I want to nap a lot on my day 1 and day 2. Day 3 starts to feel much better because that's when estrogen starts rising for most of us, right? So first 2 days, see how you feel. If you're in a lot of pain, if then please connect with someone. You shouldn't be in a lot of pain. If you're losing a lot of blood, again, like if you're losing way too much blood, please connect with someone to talk to them about it, a healthcare professional. So you might feel a little bit more, maybe irritated, maybe down, tired, whatever the case may be. And it's a good time to take it easy, right? Like walk, stretch, nap, do nothing. Movement will help though. Like if you have any discomfort or pain, movement is great for that. That can be as simple as a couple of yoga poses. That can be as simple as like doing hip circles. Like any movement, especially in the midsection, really helps with menstrual pain. But yeah, like our energy usually starts dwindling a few days before our period starts and then a couple of days into our period. So take it easy. A lot of the conversations I have, especially with people who do like long distance running or more endurance activities, I always tell them, I'm like, they're like, I feel really tired before my period. I'm like, yeah, well, your hormones have dropped. So the best solution is actually just take it down a notch. Instead of going for 5 kilometers, go for 2 kilometers instead, right? Like, so you can still keep up with your activity, whatever the activity it is, but you don't have to push yourself as hard because then you also deplete your stores and you do need to replenish them. We can't just, always keep going.
So try to tap into your intuition and really listen to your body. It is your best guide. All right. Going back to thyroid. again, we've fielded these questions. So kind of a lot of thyroid stuff, but
Mm-hmm.
what about life without a thyroid? Is it okay to consume a lot of fruits and nuts and do workouts as long as you're not overdoing it?
Yeah, so if you don't have a thyroid, typically you're put on, Synthroid or T4. We do need our thyroid hormones for a healthy metabolism and for healthy so many other things. But yeah, life should continue as normal. Your dose may need to be adjusted from time to time, and I'm sure, like, if someone's on Synthroid, they're usually being monitored. So or if they're taking levothyroxine or T4, they're usually being monitored. So yeah, you can, I always recommend working with someone because as the average person, we don't really learn much about nutrition, right? Like we don't really learn much about nutrition or our bodies or our cycles in school. So if you work with someone, even if it's just like a check-in to see, hey, do you think that I'm getting adequate, protein, macronutrients, fruits, vegetables, all my nutrients? Like I think it's always a good idea for people if they're able to do it. And then the other thing that can be helpful is tracking like a couple of days of your normal eating through like an app that will give you a breakdown of your nutrients. Usually don't recommend it for people with a history of eating disorders, but for anyone else, it's really a great way to kind of do a check-in of, am I getting enough, protein in a day? Am I getting enough healthy fats in a day? Am I getting enough fiber, iodine, iron, whatever the case may be, calcium? It's a good way to sort of check in your nutrient status from time to time. But yeah, with the thyroid removal, most people do really well. The usual problem I find with a thyroidectomy is if someone has also had a parathyroid gland be removed at the same time, because that really messes up with calcium balance, because your parathyroid hormone is really important for calcium balance. So those are usually the problems that I see with someone who has had a thyroidectomy. Other than that, they can usually live like good, healthy lives.
Awesome. That's great news.
Mhm.
Okay. Speaking of like how to find, a good doctor, how can naturopathic doctors help? What are good signs of naturopathic doctors?
It's a loaded question, but
I know,
it's a great
right? It
question.
really
Yeah. Okay, so naturopathic doctors, they vary from province to province, states to state. Even regulation of naturopathic doctors is different, and not all provinces, not all states, and other in other countries, not naturopaths aren't usually regulated universally. So first of all, you want to make sure that they are accredited. Even if your province or state is not licensed, they should carry a license somewhere. And then you can usually, find that on their website. That's a good sign, because you want to make sure that they have the adequate, training, especially in physiology, pathophysiology, nutrition, and all those sorts of things. Honestly, you have to connect with whomever you're working with, right? Like you have to have some trust in them, because it's not helpful if you're going to be questioning everything they say. And then you also want to, most of us do these discovery calls where you can kind of hop on a call and see what we can offer. You also want them to be able to review blood work, whether that's been done through the naturopath or through the medical doctor. It doesn't really matter. I personally don't do a lot of non-blood work testing, as in like I don't do a ton of like other salivary, urine, and stuff like that testing. Most testing can be done, especially in my patient population with periods, PMS. PMS you can't even determine on blood work. PCOS, endometriosis, fertility, and stuff like that. Most of the stuff we can do through blood work, like if we're testing for stuff. And then someone who is going to not just give you supplements, but will also support you through, diet and lifestyle. Because ultimately, as I mentioned before, everything impacts our health and everything is interconnected. So you want someone who will try to connect the dots of your story, considering your genetics, your life experience, your personal history, your medical history, your current symptomatology, as well as your goals, right? Like sometimes I have patients who I see a lot of like risk, cardiovascular risk. And then we talk about them, but the patient right now is like, I first of all, I just want to get rid of my acne. So then we work on the acne first, right? Like, so we also want someone who will work collaboratively.
I love that. And I love that you mentioned, somebody that's not just going to give you a pill, but somebody that's going to help address lifestyle. And like I've been learning, like in Dr. B's gut health course and stuff like that, thyroid issues, gut dysbiosis, cycle issues, all of it not only can have to do, of course, with our lifestyle, but our past and stress and, trauma. So when you are let's go to when you're addressing lifestyle and food in particular, what do you suggest for people when it comes to dietary changes? I know that you are plant-based. Is that something that you encourage? Just more plants on your plate as much as you can? How do you go about that?
Yeah. So obviously, as you mentioned, I'm plant-based. I've been vegan for 14 years-ish. Yeah. So I'm a big proponent of that kind of life. However, it's never my intention to, impose that on someone else. So but the goal always is, as we know from a health perspective, for longevity, for decreasing morbidities in the long run, plants always win, right? Like we need lots and lots of plants, regardless of what else you might be adding in. So yes, it's always about adding more plants in. And going back to endometriosis, if we look at endometriosis populations versus people who don't have endometriosis, if we look at the research, those who have endometriosis tend to have less fruits and vegetables, right? And that in itself is a very interesting correlation that's been found. And we see that in cardiovascular disease. We see that, in diabetes and cholesterol issues and in fatty liver and in so many issues, right? Like in so many chronic conditions, we see this sort of pattern of low plant food consumption. So adding in plant foods is always a good idea. So I do add in for a lot of my patients. I'm like, let's do one meatless day per week. So we can start to do that. And then add in, slowly we'll add in we'll pick a fruit or a vegetable. And I'm like, okay, let's add that in on a daily basis, or like one fruit per day. Again, for people who have been avoiding fruit, we start with one fruit. We usually start with berries because they have low glycemic index. It also has most bang for, their intake. So we'll start there, and then one vegetable. Like we really start slowly. And then if they say they hate a certain vegetable, we pick a different vegetable, right? Like we want to make it easy for a patient. So I always start with the ones I'm like, okay, what's the easiest one to get, or like what's going to give us the most bang for our buck? So that's usually the approach. And it's sometimes it's a negotiation. I'm like, okay, how about this? So that's how we usually do that. It's always encouraging people to eat more fruits and vegetables for sure, and also like whole grains, like switching to whole grains instead of, our white grains. And sometimes that might be as easy as doing half. So I grew up in a Pakistani household. We had a lot of basmati, like white basmati rice. So sometimes it's nostalgic too, right? Like food. So I still have my white rice, but what I'll do is most of the time I'll do half quinoa, half rice. So it's not just white rice. And then, lean more on like the black rice or the wild rice or the brown rice most of the time. But when I want the white rice, I don't really not eat white rice because I love my white rice. So it's about like making those small changes, right? Like, and they don't have to be perfect. And the word perfect is, sort of overrated, as we all know. It just has to be a little bit better than before. And that's what food choices become all about. It's about relative to what, right? Like, what are we comparing this to, and how can we make a slight improvement from there?
I love that. Yeah. Looking at not somebody else and what they're doing and comparing yourself to that, but looking at your own journey and looking at how much better you have become week after week or day after day, just based on the choices that you're making. I love that. Hey friend, before we get too far into this episode, I want to be sure you know about how the environment plays a role on your overall health. For over a decade, I've been learning so much about the lack of health regulation in the personal care and food industries, and that's actually one of the reasons why I started this show. You deserve to know how to protect you and your family from unwanted body burden, and I share further information about how to make better choices and vote with your dollar in our private Facebook community called The Urban Pharmacy. On that note, I want to let you know about one of the easiest ways that we've switched to safer, and that's through my favorite clean beauty brand called Beauty Counter. Your skin is your largest organ, and what you put on it every day matters a lot. And with a low carbon footprint, cruelty-free formulations, and high-performing results, I haven't found a better beauty brand than Beauty Counter in over 5 years of working with this mission-driven brand. To learn more and shop clean, head to mybetterbeauty.com. Okay, so if someone is perimenopausal and needs to maintain good testosterone levels, but and she's taking the traditional Chinese medicine, herbs, and acupuncture route, and says she feels awesome, but wants to know about that testosterone because all of her other levels went to normal, except that.
Right. So it's so variable. So testosterone is an interesting one, and it also depends on symptoms, right? Like what symptoms are being experienced. Some people do okay and feel okay at a lower testosterone level versus other people. And here's the thing I'll say about blood work, right? Like if they're being tested on blood work reference ranges sometimes are kind of arbitrary. For lack of a better word, like in Ontario, a lot of the reference ranges are actually created from the mean of the population going to that particular lab. So even lab to lab, there's differences in reference ranges.
Wow.
So just something to keep in mind as you go through that. It ultimately, like, I always say this to anyone who wants to work with me or is working with me. Blood work always has to be taken with your body and your experience in mind. We can't take blood work on its own. We can't take, obviously we'll take your experiences and kind of relate that back to the blood work, but blood work, we can't really take it on its own. Obviously there's markers that we want to not be too elevated or anything like that, or too low or anything like that either. But, PMS is a really good example of this. People can have, you could have PMS and I could have no PMS, and our blood work could look exactly the same, and we wouldn't be able to tell if, through blood work. So going back to the testosterone piece, it could be a pathway issue, right? Like a biochemical pathway issue. It could be a dietary issue where we're perhaps not having enough precursor molecules. It could be like a stress response because if we look at the testosterone pathway, the same precursor molecule feeds into your DHEA production from your adrenal glands, and then you create testosterone, but that same parent molecule also goes to the progesterone pathway. So it could be like an imbalance of like pathway support. It could be some nutrient deficiencies. And then for perimenopausal women, one of the biggest thing that I always say is you want to preserve and put on more lean muscle mass. Like there is no replacement for that because as estrogen declines later on in life, or as estrogen starts to decline, your lean body mass, your lean muscle mass will decrease. So we want to preserve our lean mass, and that actually does boost testosterone levels as well. Weightlifting, resistance training, strength training, whatever you want to call it, however you want to do it. But the preservation of lean muscle mass is really, really important. And I would say especially for all cycling people, like really important, start at a younger age.
Mm-hmm. Okay. Awesome. All right. How about full-blown menopause? What can people do to minimize hot flashes?
Right. So hot flashes, there's a lot of ways to do that. There's some herbs out there that you can use. So some of the top ones, and obviously, consult with someone before you take them, would be sage. There's rhubarb. Those are like two really common ones that we use. Maintaining good body temperature. And what really plays a role in hot flashes is cortisol. So your stress hormone cortisol plays a huge role here. So stress management, self-care, rest, recovery are all really important, as well as maintaining blood sugar levels. So a lot of people find that if their blood sugar is kind of going wonky, then they may experience a bit more hot flashes, especially as their stress response also gets triggered because of the change in blood sugar. So those are all really important things. Wine, I know, is a big one that people, drink a lot of around that time. because there's a lot going on. Or, from a habitual perspective, if they've been accustomed to drinking alcohol can definitely worsen hot flashes as well, because it changes how your blood vessels react. It changes, it also puts a little bit of an extra burden on your liver. So all of those things can be factors for someone's hot flashes. And then last but not least, you can use bioidentical hormone replacement therapy. So most of the time it's estrogen and progesterone that you're using. And the lowest effective dose is what you want to use. Bioidentical hormone therapy it got a bad rap from a couple of studies in the past, but when used safely and at the lowest effective therapeutic dose, it's actually really helpful for a lot of people.
Good to know. Okay. And going back to our cycle, and we mentioned, activity, and maybe this is going to be person to person as well, but there's a lot of hype about eating specific foods for your cycle and at specific points in time in the month. Is that something that you teach? Or is this just another fad?
Yeah, so there's definitely merit to that. It doesn't mean you have to, transform everything from week to week, depending on which phase you are in your cycle. But the goal there is to just support your physiology, what's happening physiologically. So if we look at the beginning of our cycle, when we're losing blood, having adequate protein and lots of iron and B12 and those sorts of things is actually helpful to just give you your body the resources to replenish any nutrients it's losing. And that's sort of the same reason why you would take it easy exercise wise, right? Like it's to build up your stores for later and not deplete yourself, because we start to feel better and like as day 3 approaches and the second week approaches, because our estrogen starts to go up, our testosterone is about to go up as well. So leaning into that. So when estrogen goes up, our digestion actually is a little bit better. We are a little bit more resilient as well at that point in time. Most people, that's the week what people want to feel like all the time, right? Like the second week is usually what we're all striving for, but it's just not our reality because our hormones change, and that's just fact. If you are someone who cycles, so it doesn't mean that you have to feel crummy the other 2 weeks. It just means you feel a little bit differently than that week. So at that point in time, it actually you digest raw foods a little bit better, just because your digestion is a little bit more robust. So there is a little bit of merit to that, because your testosterone has also gone up. It's a good time to perhaps do a little bit of strength training, take your exercise levels up a notch.
That was the question I was gonna ask. Optimal performance for female athletes, perhaps during that phase, then when our
so the second. Yeah. So like the middle sort of 2 weeks is usually when people do a lot better with those sorts of things. Again, it's because of the hormonal changes, because remember, your hormones aren't just your hormones. Your hormones interact with so many parts of you. We haven't even fully mapped this out. Like that's how many parts that, or different areas of our body that your hormones are interacting with. So your digestion is going to be impacted, your mood, your motivation, your fluid retention, your energy levels, your sleep even can get impacted. So there's so much that can get impacted. So that's kind of why we sort of, I definitely do teach a little bit of like leaning into your cycles. So, and that's why we also want to track, right? Like for you, it might be a little bit different than it looks for me, and that's totally fine. So yeah, second week is usually when our digestion is a little bit more robust. And then as our hormones rise, especially closer to ovulation, and then even after ovulation, that's a great time to focus on like your cruciferous vegetables, your kale, bok choy, arugula, those sorts of things, and more like fiber and stuff like that, in order to support healthy hormone metabolism. And then as we approach the last week of your menstrual cycle leading up to your period, that's usually when energy can start to drop. That's usually when we try to fight against our cycle a lot in that week, right? Like we might over caffeinate, we might over alcoholize, or our intake of alcohol might increase because our anxiety can increase depending on what our hormones are doing. We might retain a little bit more water. We become a little bit more sluggish, but some of the activities that we do and we push ourselves harder actually worsen PMS, and they worsen what we're trying to get rid of or push through. So when possible, it's actually a really good idea to take a step back and take it a little bit easier in that week. Obviously, that's not always possible, but when possible, it actually improves all those symptoms just by taking it easy and adding in. And this is the time where you want to add a little bit more cooked foods in, because your digestion is a little bit more sluggish because of the hormonal changes. You may retain a little bit more water. That's a great time to add in more soy protein. So soy protein specifically can help in that premenstrual week, and lots of fruits and vegetables and fiber and hydration.
Got it. Awesome. Okay. Thank you. How can you keep your pancreas from making stones?
How can you keep your pancreas from making stones? So stones in any organ usually happen over a long period of time. And sometimes they happen because the flow through those organs isn't ideal or optimal. Sometimes it's nutrient related. Sometimes there's a genetic predisposition. So depending on what is happening, the best way, honestly, is always to make sure that you're having a diverse, healthy diet that doesn't put extra burden on any which organ. So that's basically my answer. Like for treatment wise, obviously things look a little bit differently. There's herbs and such that can be used. Again, not really my area of expertise, but yeah, I've had patients with stones in their gallbladders, kidneys, pancreas that we've eliminated over time.
And do you work with people remotely?
I work with people remotely, however, only in Ontario, because my license only extends to people in Ontario, Canada.
Okay.
And then for periods, I have an online program that's open to anyone, anywhere.
Wonderful. So that brings me to my question. Where can we find you? And do you have any resources? Because this has been a very helpful conversation. And I know that people, women in particular, are going to want to know more about how to stay in contact with you.
Yeah, of course. So as you know, we met on Instagram. So I'm on Instagram quite regularly. My handle is dr.Hussain. Through there's my link tree where you can sort of find my blog. Recently, I've been posting a lot more on PCOS, insulin resistance, liver health, and stuff like that. And then if someone is looking for more like PCOS related blood work, you can always download my PCOS blood work checklist, which is annhussain.com/PCOS checklist. What else can I tell you? Yeah. And then I have an online program that I run 2 to 3 times per year. It's called Periodicity. It's all about laying the foundation for healthy cycles and leaning into our cycles. So a lot of what we talked about today, actually, what we can do from a food perspective, even like language and narrative perspective, because again, like we grow up really not learning much about our cycles, and also having so many like euphemisms for our period and like hush hush about it, right? So like we sort of internalize that and grow up in that sort of mindset that we're not supposed to talk about it. And so many people have menstrual issues, and the reason why they don't get care for it is because they don't know what's normal and not normal, right? Like because we've never talked about it. So yeah, that's what my online program's all about. I really love running it. I run it live. And yeah, if anyone wants to reach out personally, then you can always reach out to me through email at ann@annhussain.com.
I love that. Okay. And this is a question that I ask all of my guests. Dr. Ann, what does living a holistic life mean to you?
Ooh, it's a good question. I could go on for a very long time, but I'll try to keep it short. A holistic life means, we're taking care of all of us, like from the mental health to the sleep and the rest and our relationships with ourselves, with our environment, with each other. Putting into our bodies foods that are good for us nutritionally, but also things that bring us pleasure. Like for me, that would be a chocolate. For me, that would also be salt and vinegar chips occasionally. You know what I mean? So like that's what a holistic life means to me. Like it's you mostly do things that are good for you, and you're always trying to better yourself because your health changes and your ideas and your education and knowledge base changes. And then but also, know that your body is resilient enough to deal with sort of the other things that you might be inputting, like salt and vinegar chips.
I love it. You're so funny. Yeah, you gotta find that whole picture that brings you joy, but also brings you health and longevity. So I love that. Okay, Dr. Ann Hussain, thank you so much for being on. And I can't wait for everyone to hear this.
Thanks so much.
I'm over here cheering you on because you just finished another episode of The Urban Pharmacy. For today's show notes, head on over to theurbanpharmacy.com and be sure to join us inside our private Facebook group called The Urban Pharmacy, where we share inspiration, live trainings, and holistic living tips to help you build community and the healthy lifestyle that you've always wanted. If you enjoyed today's episode, make sure you hit that subscribe button and please consider leaving us a 5-star review. Before we connect again on the next show, follow me on Instagram at The Urban Pharmacy. That's urban with an H and pharmacy with an F. And I can't wait to hear your wellness journey as we get to know each other better. There's truly no better time than now to level up your life. And I am so proud of you for showing up today. Until next time, be well, Health Crusader.